Hello and welcome. Today we're delving into a complex and often challenging condition, autoimmune-related interstitial lung disease, or ILD. We'll explore what it is, why it happens, how it affects the lungs, and what can be done about it. Autoimmune-related ILD, as the name suggests, arises when the body's immune system mistakenly attacks the lungs. In healthy individuals, the immune system protects against foreign invaders like bacteria and viruses. However, in autoimmune diseases, the immune system turns on itself, targeting healthy tissues. In the case of autoimmune-related ILD, this misguided attack focuses on the lung tissue. This can be associated with well-defined autoimmune diseases such as rheumatoid arthritis, systemic lupus erythematosus, scleroderma, Sjogren's syndrome, and myositis, or occur as a primary ILD with autoimmune features. The precise mechanisms by which the immune system damages the lungs in autoimmune-related ILD are complex and not fully understood. However, it involves a cascade of events. Immune cells, such as lymphocytes and macrophages, infiltrate the lung tissue. These cells release inflammatory mediators, like cytokines, which damage the delicate air sacs called alveoli and the surrounding supporting structures. This inflammation leads to fibrosis, or scarring of the lung tissue. As the fibrosis progresses, the lungs become stiff and less able to expand, impairing their ability to transfer oxygen into the bloodstream. This leads to shortness of breath and other respiratory problems. The exact prevalence of autoimmune-related ILD is difficult to determine, as it often overlaps with and is considered a manifestation of the underlying autoimmune condition. It's estimated that a significant proportion of individuals with systemic autoimmune diseases will develop ILD during their lifetime. For example, a substantial percentage of patients with rheumatoid arthritis and scleroderma experience lung involvement. Women are generally more affected than men, reflecting the higher prevalence of autoimmune diseases in women. The signs and symptoms of autoimmune-related ILD can vary in severity and presentation. The most common symptom is shortness of breath, particularly with exertion. Other symptoms may include a persistent dry cough, fatigue, chest discomfort, and weight loss. In some cases, patients may experience digital clubbing, which is a widening and rounding of the fingertips and toes. It's important to note that these symptoms can develop gradually over time, making early diagnosis challenging. Diagnosing autoimmune-related ILD typically involves a combination of methods. A thorough medical history and physical examination are essential. Pulmonary function tests, such as spirometry, help assess lung capacity and airflow. Chest imaging, including high-resolution computed tomography, or HRCT, scans provides detailed images of the lung tissue and can reveal patterns characteristic of ILD. Blood tests are conducted to identify specific autoantibodies associated with autoimmune diseases. In some cases, a lung biopsy may be necessary to confirm the diagnosis and determine the specific type of ILD. Autoimmune-related ILDs can be categorized based on the underlying autoimmune disease or the pattern of lung involvement observed on imaging and biopsy. Common patterns include usual interstitial pneumonia or UIP, nonspecific interstitial pneumonia or NSIP, organizing pneumonia, and lymphocytic interstitial pneumonia or LIP. The specific pattern helps guide treatment decisions and provides information about prognosis. Some patients may not fulfill the diagnostic criteria for a well-defined connective tissue disease and are classified as having interstitial pneumonia with autoimmune features or IPF. Treatment for autoimmune-related ILD aims to suppress the immune system, reduce inflammation, and slow the progression of fibrosis. Immunosuppressant medications such as corticosteroids, mycophenolate mofetil, and cyclophosphamide are commonly used. Anti-fibrotic medications, like pirfenidone and nintedanib, can help slow the progression of lung scarring. Supportive care, including pulmonary rehabilitation, oxygen therapy, and vaccinations, is also important. In severe cases, lung transplantation may be considered. Currently, there's no definitive way to prevent autoimmune diseases themselves. However, managing underlying autoimmune conditions effectively may help reduce the risk of developing ILD. Avoiding smoking is crucial, as smoking can exacerbate lung damage and worsen the prognosis. Early detection and prompt treatment are key to slowing the progression of ILD and improving outcomes. The prognosis of autoimmune-related ILD varies depending on several factors, including the underlying autoimmune disease, the severity of lung involvement, the pattern of ILD, and the response to treatment. Some patients experience a relatively stable course, while others may experience progressive lung disease. Recent research is focused on identifying novel biomarkers that can predict disease progression and response to therapy. Clinical trials are investigating new treatment strategies, including targeted therapies that specifically inhibit the inflammatory pathways involved in lung damage. Advancements in understanding the underlying mechanisms of autoimmune-related ILD offer hope for improved treatments and better outcomes in the future.